This slide's presentation covers the basics of task analysis, and it's composed of both the O'Sullivan Chapter 5 reading assignment as well as the Quinn et al. 2021 article. So what is task analysis? And task analysis is really just breaking an activity down into its component parts. And it requires knowledge of how normal task is performed. So if you have a patient who you're watching do a task, let's say go from sit to stand, you should have a pretty good feel or some idea of what it looks like for a person without neurological injury to go from sit to stand. Then you also have to be able to examine the patient's performance. So how does your patient go from sit to stand? And then you need to be able to compare and contrast the patient's performance to the typical performance or a performance of a person without neurological injury. Once you do that, you can look at the differences and try and understand, why is that person moving that way? Or what's stopping them from moving in a normal movement pattern? And the last part of task analysis is understanding how the environment can affect the performance of a task. So there are different types of motor tasks. Okay, one kind of motor task is a mobility task. And this is where both the base of support and center of mass are in motion. Okay, essentially you're moving the body from one posture to another in a controlled manner. An example of a mobility task would be walking or scooting along the side of a mat table. Another type of motor task is a stability task, and stability tasks there are two different kinds. There's one that requires static postural control, and there's one that requires dynamic postural control. Okay, stability tasks that require static postural control, neither the base of support or the center of mass are moving. An example would be just standard static sitting, just sitting still or standing still. Okay, and when you're looking at static postural control, you're looking for the person's ability to maintain posture in a stable, unchanging environment. With dynamic postural control, the base of support is fixed, but the center of mass is moving due to changes or motion of upper extremities and lower extremities. An example of this is a reaching activity, and these reaching activities can be performed in either sitting or standing, or having a person just step up and step back down onto a step. Okay, with the stability task that is a dynamic postural control task, stability is constantly being adjusted during the task due to the motion of extremities. And when you're doing a task analysis, there are some questions that it's important to consider. And the first question is, what are the normal requirements for the functional task being observed? By this, I'm suggesting that you should consider range of motion requirements, strength requirements, cognition, sensory or perceptual requirements. What are the initial conditions of the task? Is the person starting running down a trail, for example, or is the person on a smooth gym floor? And as far as initial conditions, how's their posture? Okay. What's the overall sequence of movements or the complexity of the task? How much timing, force, and directional requirements are required, specifically for the termination of movements? And what are the balance requirements that are necessary to achieve the task? Okay, the next question is, how successful is the movement in terms of the intended outcome? And here you want to consider the quality, efficiency of the movement. Were the movement patterns typical or normal? And if not, was it the entire motion that wasn't normal, or were there just parts that weren't normal? You also want to look for any compensatory movements that were used, and is fatigue a possible factor? And you should also consider if adaptive equipment was required for the task. And finally, what environmental factors must be considered? So here you want to consider, would you expect the person's performance to change if there were a different environmental context? And an example of this would be a person with a brain injury who is highly distractible. If you're asking this person to complete the task in the environment of a busy gym where there's lots of distractions happening all around them, the performance of the task might be very different than if you were asking this person to complete the task in a quiet, private room where there were no distractions. Okay, so those are just examples of guided questions for task analysis. Now moving on to the Quinn et al. Article outlines a framework for movement analysis of tasks. Okay, this article was put out essentially by the Academy of Neurologic PT, and they recommend 6 core tasks for movement analysis by physical therapists in patients with neurological injury. Okay, these core tasks are sitting. In sitting, person just sits unsupported on a firm surface for 30 seconds. The next task is sit to stand. So they're recommending the person just stand from the surface with their self-selected base of support. The next task is standing. Again, the person just stands there for 30 seconds quietly with their self-selected base of support. The next task is walking. So have the person walk 10 meters out, turn 180 degrees, and walk back. Next, you want to have the person step up and down a step. Essentially, they're going to ascend a 7-inch step with, say, their right leg, and then descend that step with the same leg. And then you want to have the person use their left leg to do the same task. And then finally, you're going to have that person in a seated position with back support, and you're going to ask them to reach for, grasp, and pour the contents of a cup of water into a receptacle without spilling it, and then place the cup back on the table surface. Okay, so these are the 6 core tasks. There are also checklists in this paper for these core tasks, and we're actually going to use these checklists to do some movement analysis for patients doing several of these tasks during class time. The Quinn et al. Article recommends that all 6 tasks are to be completed in the order listed. The tasks should have consistent initial conditions for consistency, and all tasks except for sitting and standing are to be performed twice. Okay, they want them performed twice because this allows the therapist to see if instructions were understood, and also the first time around, the therapist can see if the patient can complete the task without assistance. And for all these tasks, the therapist is to give as little assistance as possible. And then finally, the second rep takes fatigue into consideration on task performance. Another thing to note is that depending on the level of the patient, if the task is too easy the first time around, it can be progressed. And if it's too hard, it can be regressed. And there are specific recommendations for both progression and regression for all these tasks. And then finally, here's a figure right out of the manuscript where you can see on the left-hand side of the slide the 6 core tasks. So sitting, sit to stand, standing, walking, step up and down, and reach, grasp, and manipulate. Okay, follow the little arrow to the right. They're recommending that you set the initial conditions and that they should be systematically varied in subsequent repetitions, meaning that if the task is too easy, you can progress the task by changing some of the initial conditions. If the task is too hard, then you can regress the task by changing initial conditions. Okay, going across the movement continuum that we talked about in the Hedman et al. Article, there's the preparation stage, and this is just to see if the performer understood the instructions and the task requirements. Moving over to initiation, execution, and termination. You're going to look at all of the things that were talked about in the Hedman et al. Article and evaluate the movement patterns. If the expected outcome was achieved, then you can repeat the task at least once with progression as needed, and that's up to the therapist's discretion if they think progression is or isn't called for. However, if the expected outcome was not achieved, then you can repeat the task with regression. And again, if you regress the task, then you'd have to repeat that task one more time just to make sure that you have a duplicate trial. And then you continue with all the core tasks in order. Okay, hopefully this information makes sense, especially in the context of the Hedman et al. Motor control article that I had you listen to before this slides presentation. And again, we will practice this task analysis during class time.